Hello, my name is Zachary Osborne King, and this is my final project presentation for MRI, my MRI class on diffusion tensor imaging. So to give a little background, diffusion tensor imaging, or DTI, is a common MRI technique used to study diffusion of water molecules. Its primary uses are in the brain, and the goal is to generate quantitative maps of the diffusion coefficients that can be used to diagnose clinical pathology, such as ischemic lesions or ischemic stroke, different diffusion patterns in the brain, alternate neural connection pathways that are indicative of different pathologies, among many other things, including synergistic effects with fMRI and even some niche applications in cancer and oncology. So to summarize the paper that I was assigned, Lebihan et al. Is a review article from 2001 going over the DTI sequence, the fundamental parameters that can be derived from it, the physics behind it, where it comes from, and the clinical applications of the sequence specifically. And interestingly, I learned through my work that Lebihan himself was one of the pioneers of the technique, with one of the key parameters in the DTI signal equation named after him, funny enough, the B parameter. So what is the underlying physics and the pulse sequence of a DTI scan? Well, essentially, it is just an EPI with a predetermined gradient, like spoiler gradient, to give it that diffusion weighting. So DTI obviously underrates EPI. So this is what this yellow here in the image acquisition module is. It's just a normal EPI sequence. But here's where all the nuts and bolts of DTI comes in. So DTI starts the bipolar gradient sequence of a specific magnitude, shown here by G, a specific time of the gradient, shown by delta, and a specific time between different pulses known as delta. These will be important when we go over the equations later, but the idea is basically that when you apply these two bipolar pulses, the stationary hydrogen molecules inside of the tissue, we'll say the brain here, don't accumulate any natural phase, but the diffusing ones do because they're constantly moving throughout the system. This is very similar to the flow effects, almost exactly the same to the flow effects we talked about when we talked about things like cardiac, when we talk about all the different cardiac imaging techniques for flow enhancement and flow um, uh, for flow enhancement. So this causes all the stationary hydrogens to have their signal canceled out in the image, and then while the moving spins accumulate random phase. Specifically, the random phase accumulation hydrogens diffusing in the same plane causes that image to darken. So when compared with an unspoiled T2 image, so just this sequence, a normal EPI sequence, we actually can get a diffusion weighted image that corresponds to this Steck-Schall and Tanner DTI signal equation, some of the two pioneering members of this effect in the sequence design, where here we have this SK, which is the diffusion weighted image by signal intensity, this S naught, which is this T2 weighted image, and then A, which is the attenuation. The attenuation is an exponential factor of this B parameter, and this D diffusion coefficient tensor, hence the name diffusion tensor imaging. This B parameter is dependent on a couple of things. So the gamma operator, so the gyromagnetic ratio squared, the distance, the duration of that pulse squared, like we talked about earlier, the delta, the time between the pulses, minus some factor of the duration over 3, and then times the magnitude of that gradient, G squared. And so this is how you sort of accumulate this diffusion constant, and this is sort of used to sort of tune what diffusivities you're looking for in your DTI image. So image reconstruction allows you to solve, basically it goes down to solving the previous equations that you get from each voxel. You collect the images through your EPI sequences along the different parallel planes that you want to image. So you go on X, Y, Z, we'll say, and then because say we're collecting it across 9 axes, you only have to collect the other 3. So XY, XZ, and YZ, and then you get a diffusion tensor for each voxel. But due to the nature of the signal, these are simplified in each voxel to be, due to the nature of the signal, you have to simplify these things to be ellipsoids because you're going to have multiple components of the signal. So you want to represent in that voxel the whole magnitude of the diffusion everywhere because you have so many hydrogens within that given voxel. So the axes of this ellipsoid correspond to the eigenvectors and eigenvectors of the actual diffusion tensor, and then the surface corresponds to the eigenvalues. So you solve that diffusion tensor's eigenvalues and eigenvectors to get the ellipsoid. And the ellipsoids are the basis of all the parameters calculated in DTI and are just visual representations of the degree of anisotropy and isotropy of the diffusion. So here, this figure is a really good example. If you just have a random orientation of 3D patterns diffusing, say you just have random diffusion by Fick's law, you're going to get this very low fractional anisotropy, which is a parameter we'll talk about later, or essentially a sphere-looking ellipsoid, because there's no one weighting one way or the other. But if you're in neurons, for example, and you have fluids and hydrogen going down the axonal plane, you're going to have a really high FA or really elliptical shaped uh, ellipsoid, because now your diffusion is weighted one way, specifically anisotropically. So for data analysis and quantification, we're going to talk about three major parameters in DTI: the mean diffusivity, diffusion anisotropy indices, so relative anisotropy, fractional anisotropy, and volume ratio. And then also we're going to talk about fiber alignment mapping. So each of these techniques is important for determining the prognosis. Mean diffusivity basically is just the average of the diagonal of the diffusion tensor. And essentially what it does is just gives your voxel a non-directional average of what all the diffusion that's happening within that voxel. It's more niche when I was looking through my work. It's used, make no mistake about it, but the bigger ones are the diffusion anisotropy indices and fiber alignment mapping. Up here, we actually see an image of the fiber alignment mapping, which orientation mapping or alignment mapping, however you want to say it. And it's used in a lot in ischemic brain lesions, but can also be used in conjunction with fMRI to identify structures where we see different things flowing, which can correspond to what fMRI's signal is popping up inside the brain. And also it can be used to see like different changes in the pathways of the brain in response to a lesion. Basically, what ends up happening is you take your ellipsoid, you find the largest component, so here the largest major axis, and take the mean diffusivity of that, and then sort of just map that in sort of a heat map fashion, like here along the fibers, and you get this really pretty map. FA, RA, and VR are all different parameters that you can use to basically just calculate the anisotropy of the system. Fractional anisotropy is the most common of these parameters from what I could tell. And basically all it just tells you is your signal really isotropic, zero, so it's just random diffusion, or is it really targeted in one specific direction or one? Here we actually see a map of fractional anisotropy in the brain, and you can kind of see here how all the different vessels and everything and are moving along the brain and feeding the different supplies. This is really useful for detecting ischemic lesions because this parameter changes incredibly when you have an ischemic lesion. It specifically drops to be more isotropic because obviously you no longer have that targeted diffusion towards the specific sites in your brain. So clinical applications specifically, the biggest one of DTI is ischemic brain lesions and any kind of brain lesion in general. So DTI is used here. So we can see here, this is a flare image of the actual brain where this big lesion is. And this group in Egypt actually decided to want to see, well, hey, do these things actually correlate? And you can see here that from their FA, which is what this image is right here, and their fiber alignment images, they sort of combine both of them. You can see here the big changes near the ischemic lesion where we're dropping our FA into this blue right here. It's a little splotchy and a bit hard to see, but you can see this blue right side this lesion where there's a lot of isotropic spreading. And then this green here where you see the fiber anisotropy is really changed here. It's not as hot as a color as this. And down here, it's a bit harder to read, but you can kind of see that there's interrupted vessel supply right here compared to like this side of the brain. The other side of the brain is a really good control in this case. You can see how much more vascularized it is on this both functional anisotropy image combined with a fiber alignment image. So this really helps with clinicians, and they found a really good significant effect of helping patients get their diagnoses quicker and more accurately to make sure they didn't have any further neurological damage. It's a very useful technique in regards to that. Additionally, I am not super interested in neurology, so I tried to find other applications. I found this really cool one with breast cancer. So there's a lot of interesting work in oncology trying to assess this. And this one study found that there's a significant effect of functional anisotropy and eigenvector parameters on late tumor size prediction for FA and early tumor size predictions during this. So basically, they would give these patients treatment and they would try to see how they would progress through functional anisotropy and and basically measure these parameters of diffusion. And essentially the idea is a tumor has so much angiogenesis going to it, it's no longer anisotropic, it's more isotropic in the area. Whereas if you restore that function, you have a more isotropic area a more anisotropic area because you're actually now targeting specific areas and the flow is going one way because you only have one specific set of vessels there. And so you can see here, this patient got their first MRI and then they got their second MRI. You can see how much the functional anisotropy changed here, sort of indicating that, hey, this patient now is sort of kind of recovering, even though their lesion is still there. For this breast cancer, we have to keep monitoring it, but this is a good sign that we're progressing with our treatment. Finally, we want to talk about the artifacts and limitations of DTI. So the big one is that DTI is super sensitive to motion artifacts. This is why it's really hard to use anywhere but the brain. You can really kind of control what your head position is due to how much control we have over our necks, but it's so, so hard to do this in like your chest region, for example, where you're constantly breathing, you have your heart palpitations and moving. It is incredibly hard to do it anywhere outside of the brain, which is why it's not often used there. And you can sort of see the destructive effects of these motion artifacts. DTI also has low SNR using large amounts of image averaging. So getting higher quality images takes way more time by either using more image averagings or investigating more principal planes of diffusion. The paper by Libby, the paper I read had one like diagram showing 628 principal directions to investigate for DTI, which was absolutely insane. I know computers are very fast, but investigating that many directions just does take a lot of time. Of course, you have to think about the gradient power for MRI safety and SAR. Finally, due to the nature of the signal, some metrics like mean diffusivity need like complex sequence design. So you need to design sequences specifically for mean diffusivity where you need to have only the three principal directions, X, X, Y, Y, and Z, Z, where you're applying the gradient in the X direction, getting signal in the X direction. But because you can have noise due to the fact of how the diffusion plane is different from the Cartesian plane, you always in your X signal are going to have some component of Y and Z in that, and that can be really challenging. And you need to design these really complex sequences to account for that noise. And so that can be a tricky thing, not an impossible thing to overcome, but combined with other things, it makes it a bit more difficult. So to wrap up, these are my sources. If you have any questions, please let me know. And I hope you all have a wonderful rest of your day. And thank you for the semester, Dr. Simonetti, Ahmad, Kolapaka, and Farkis.